My name is Dr. Milan Satcher. I am a family medicine physician and I support Bernie Sanders' vision of Medicare for all. I have worked in outpatient clinics, emergency departments, inside of the hospital on medical teams, as well as on surgical teams. In addition to my background in public health, this training across medical settings has really given me a tremendous empathy for the challenges that patients experience as they attempt to navigate our very complex medical care system, as well as the challenges that my fellow providers experience in their endeavors to provide care. Us physicians, we went into the field of medicine with the purpose of helping people, and particularly helping people to achieve their best health possible. In medical school, we learn about the science of healthcare, about the complexity of the human body, and how we as doctors can intervene to promote health. And through this process, we are energized and hopeful that as physicians, we will be able to make a difference in the health of all of our patients. But then we graduate from medical school and we enter the real world and we begin to practice medicine, and we come face to face with the system of healthcare. And we abruptly realize that we will not be able to treat all of our patients equally, and due to the constraints of the healthcare system. And at least when I was in medical school, we didn't have any dedicated classes on the structure of healthcare insurance in the United States, but we as physicians come to learn about this structure through the barriers that we experience in our endeavors to provide care to our patients. We come to learn that there's a population of patients with no health insurance, and that when they present for care, they assume the full responsibility, financial responsibility of their care. And as such, we're more likely to see them in the emergency department, coming when their symptoms have become unbearable and they are in need of urgent and emergent care. And without insurance, they've been unable to see their primary care provider who could help to prevent the complications that bring them to the ED. We learn that there's a population of patients who have insurance, but they're underinsured, meaning that their insurance provides only partial coverage, or they have high deductibles that require that they pay large out-of-pocket costs before their insurance will become activated. And for these patients, we experience as we try to take care of them that they're unable to afford their medications because they're not included in the coverage that their insurance has, or they have to pay out of pocket first. And so these patients, sometimes we see that they ration their medications, or they're not able to attend their follow-up appointments because it's just too expensive. We also learn that there's a population of patients that has great healthcare insurance, or they're of a socioeconomic status where they're able to afford expensive premiums that give them quality insurance, or they're able to afford the high deductibles or to just cover the costs that are incurred from only having a partial insurance coverage plan. But even with these patients, sometimes when we prescribe medications, their insurance company denies them, and we have to go through this petition process in order to convince insurance companies to provide coverage. But all the while, as we do that, that person is going without that medication and is delayed in their treatment. And then we also learn about a population of patients who have Medicaid, Medicare, and CHIP. And even though they have insurance coverage, they have a limited access to providers because for some providers, they don't accept these forms of insurance. And so sometimes for them, it can be hard to find healthcare systems that will take care of them. And often, really what we see as providers is that patients don't stay in one category of these insurance experiences. People experience different forms and different types of this insurance. Particularly, if you lose your job and you had a great insurance coverage, then you become uninsured. And perhaps then you are eligible for Medicaid, but you have to switch your doctor because perhaps your doctor doesn't accept that insurance. So oftentimes people are experiencing the different challenges of not having a universal healthcare coverage plan. And as a physician bearing witness to the challenges and the suffering of patients and knowing medically the treatment that would alleviate their suffering, but not being able to provide that treatment on the sole basis of insurance coverage or lack thereof is honestly the greatest unanticipated challenge of being a doctor. And speaking honestly, it inflicts a moral injury and it hurts. And it's disheartening to sit across from my patients face to face and be helpless when I came into this field with the sole purpose of helping people. And for this reason, I wholeheartedly support Medicare for All, and particularly Bernie Sanders' vision for Medicare for All. He has been unwavering over the decades supporting universal healthcare coverage. And I don't know about you, but when I think about the person that I want to fight for Medicare for All, I want the person who has demonstrated commitment. And I want the person who, particularly for me, is committed to allowing me to do my job and serving patients effectively. And that person is Bernie Sanders.